varus stress test for the elbow. To perform the varus stress test, you're going to have your patient either sitting or standing. She's going to be standing for this one. You're going to have the elbow flexed at about 25 degrees, and the varus stress test is going to be testing the RCL ligament integrity. So for an RCL sprain or other sort of pathology. To test this, you're going to take one hand over the medial aspect, thumb going up the shaft of the humerus, and your hands are going to wrap around to the lateral aspect of the elbow, or the lateral joint line. Your other hand is going to come just proximal to the wrist, and you're going to provide a varus force to stress the RCL ligament. Did you feel any pain with that? Positives for this test are going to be pain or laxity. This patient does not experience any on her injured side. You would test bilaterally. The second test I'll be performing today is going to be the passive golfer's test for medial epicondylation or medial epicondylitis. To perform this test, you're going to have the patient start sitting or standing. This test is going to start at 90 degrees of elbow flexion, supinated wrist, extended wrist, and I'm going to provide a continuing extension on the wrist, and I'm going to palpate the medial epicondyle. Relax. This is a passive test. I'm going to passively extend the elbow. Relax. Did you experience any pain?
No.
If the patient reports pain, that would be a positive test for medial epicondylitis or epicondylation, golfer's elbow. You compare this bilaterally to compare the tested findings. The third test I'll be performing today is going to be the tenelles of the ulnar nerve. To perform this, you have your patient at a 90 degree, and then you have them slightly externally rotate or extend the wrist or extend the shoulder to gain access to, flex the shoulder to gain access to the area. You're going to palpate the medial epicondyle. You're going to take your two fingers, and you're going to go proximal to distal, and you're going to go posterior to the medial epicondyle. Did you experience any numbness, tingling, or burning sensation in the hand?
No.
Positive signs for this test are going to be the burning in the hand, tingling, or numbness report. This patient does not experience any here. I will then go to the other side and test bilaterally to compare the findings.